Alex, thank you very much. And hello, everyone. I've turned on my camera here for a second just to say hi and let everybody see it's really me back here. Really appreciate everybody joining us today. And we're going to go through my latest hot topics and current trends slide deck that I created in the last month or so. There's a couple of slides right at the beginning you're going to see that are newer. The other ones I have collected items from September through December into January, and as I usually do, then went through them and found the most important things and put together a slide presentation, which is what I'm going to give you now. So it's really items that got on my radar screen, and I filter that. There's other things too that are important, such as the new HIPAA rule. But I've spoken about that in the past, and we don't have any more current information on it yet. We certainly think that it will drop sometime in the spring, but we're not sure. So we're going to talk about other topics today. And just a second here. Sorry, I'm flipping the screen here. Okay, so we're going to talk about other things today than the new HIPAA rule, but everything seems to be moving in the direction of getting the new HIPAA rule, which will be in the springtime, quite a large lift for us. I am doing a series of webinars between now and then on other topics, but as soon as we hear anything further on a final rule, I'll get a webinar together as quick as possible and get that up, and we'll do it. So let's start with, though, a couple of quick slides. And by the way, as always, I'm very content heavy and overgunned in the number of slides that I have. So we're going to go pretty fast through them. And, you know, you can use the slides as reference materials as we go. There will also be a recording available afterwards, and we'll send you an email about that. So what did I see recently from OCR with fines that we should be concerned about is that we had a lab not providing medical records. You would think that folks would be kind of getting the point on that now, but you know, getting fined $16,000, and it may not be a really large lab, so that could be a very significant amount of money, and showing that you don't have to be a provider of care, you don't even necessarily have to be a business associate, you can be a covered entity or a BA like a lab and still end up with fines. So medical record access fine for that. We got a large provider. I don't really give out names of who, even though you can read that stuff, it'll be on the wall in OCR's posting. But we had a very large provider organization with a hacking incident that caused $2.81 million patient breach. They got a $1.25 million fine or agreed to the penalty. And so, you know, it's small organizations, large organizations, enforcement continues with HIPAA. That's the main point here. And that it's not just about the breaches, it's about, did you have your risk analysis in place, your policies in place? All of those are included. So you get a hacking incident, then they look at everything as they do and come up with other areas, and the penalties end up larger. Personally, I've gotten 2 breach letters in the last few weeks, one from a provider of care of mine and the other from CMS. So my Medicare information got breached. So, you know, breaches are not particular just to CEs and BAs. We've got personal information going out in other places too from other sources. Another big thing that has come up on the screen is that the public health emergency is going to end. And what that means is actually fairly complex. So if you are a covered entity and use the public health emergency in any way for, let's say, telemedicine or other areas that were covered, that will be coming to an end. I think it's in May 11th, that's right. And there's a fact sheet put out by OCR that is worth looking at, because some organizations did use the public health emergency to implement things like telehealth in ways that are not necessarily meeting all the HIPAA standards. So you're going to want to review what you've done and make sure that this coming to an end isn't going to get you crossways with HIPAA. We're going to talk about 405D cybersecurity. Again, I've actually done these slides a few times. There's just 2 of them here, but it's important, very, very important. Because we do several different things at CompliancePro. We have software, we do privacy incident management, we do risk analysis. We actually see a lot of different organizations and what they're doing, and how even other consultants are working with security risk analysis these days. And not everyone has adopted from both the analysis side, risk analysis side, and from the operations side, the cybersecurity practices that are outlined in the 405D and Public Law 116.321. And it's really something to pay attention to. You've got to get recognized security practices, whether they're 405D or not, into place as soon as you can, because it allows for potential mitigation of penalties and enforcement actions on the security rule side. So it's very important to take the practices that have been laid out in the HICP, Healthcare Industry Cybersecurity Practices, and to understand which ones you're already using, which ones you need to implement. So again, they're practices, they're voluntary, they're not required, but they can result in having less liability on the security side of HIPAA, and that's a big deal. So we just talked about somebody that got hacked and got a $1.25 million fine. Now, would these practices being in place have helped in that situation? I can't say for sure, but I would think it's likely. So understand that you need to be looking at cybersecurity practices and what they call recognized security practices. And we're going to talk more about that in some of the other slides. These are the practice areas that have to be addressed. And you do address a lot of these with the standard HIPAA and HIPAA security risk analysis, but not all. It's not a complete overlap. There are protections or practices with the 405Ds within the practice areas that are different than what you might be doing under HIPAA. So it absolutely behooves you and your organization to understand these rules. Now, OCR has put out a video on recognized security practices, what they are and how to use them. There's a link. And of course, I've tried to, in various slides, give you different links to the subject matter on the slide. And in this case, you really, to learn this, you're going to have to watch the video. But what they're telling you is that a recognized security practice might be these 405D areas and practices that they put up, but there are other frameworks or security practices that you could use that may qualify. And this video will help you understand how to figure out whether other types of security practices will qualify for the enforcement discretion that can come. So it is behooves you to determine which type of recognized security practices you're going to implement and get them implemented. They must be implemented for 12 months prior to any incidents or anything happening for the enforcement discretion to kick in. So it is important for your IT teams to understand what type of recognized security practice are they going to use, and go ahead and start working on that. The recognized security practices under 405D have been cut up to address small, medium, and large healthcare organizations. That's why I like it so much, because we have customers that range from very large healthcare organizations, hospital chains, down to single physician providers and business associates from very large to very small. So having cybersecurity practices that at least you can say is it small, medium, or large, and try to fit those practices, and to be able to disregard the ones for small practices that really are more applicable and only affordable by medium or large organizations is valuable. So while you may not be just using the 405D rules, you may use some other security rules to meet these cybersecurity recognized security practices. We really like the 405Ds because they are small, medium, and large as well. OCR has really tried to define, without listing, what other security practices might be acceptable to them other than the 405D. So again, that's what the video is going to show you. You're going to have to be thinking very seriously about looking at your policies and procedures to implement cyber controls. Assets, hardware, and data, at least, you have to manage those and inventory them and have control of your hardware and your data. System diagrams, data flows, all that is a part of implementing recognized security practices. There's also a OCR summer newsletter in 2020 that gives details of things like asset inventories. I have found that if you dig, you can find quite a bit of information that OCR publishes to support their rules. Now, we have a library. This is in the CompliancePro reference library. And it's easier to find there, but it can be found out on the internet. What would happen in an investigation with recognized security practices is that you have to illustrate evidence. OCR has always, but is seemingly getting more and more where they're requiring evidence of implementation. And so you can see from the list here that they're looking at dates on all your documentation. How have you assessed yourself, especially on the security side? And although privacy sometimes bleeds in, but how are you assessing your security? Third party, yourself, all of that evidence, you may do both. OCR is going to want to see it. They're going to want to see your asset management inventories, your data flows, contracts with vendors who are providing some of the tools. So let's say access management, you're using some kind of a log-on account management tool, and you have a contract with a vendor for that. That's fair game for showing OCR that you've partially documenting how you've implemented that as part of the control package. Statement of works, invoice, project plans, and certainly policies and procedures, which may not be the same document, but may work together. Other things like vulnerability scans, training materials, you can read it on the screen, minutes of meeting, screenshots, all of that can be used to document what you're doing in your recognized security practices. Again, 405D has ones that are more listed, but there are other security frameworks that might work as well. I'm not going to name them because even OCR isn't naming them. They're more telling you how to use another security framework if you're so inclined for your recognized security practice. If that's confusing, I'm sorry, it is kind of confusing, but the bottom line is choose your cyber controls with care. Keep a lot of documentation, keep that documentation for 6 years, and be aware that you do need to be having some kind of recognized security practices in place. Online tracking, exploding in healthcare. I think what this came on the scene as 6.5 million persons across several major healthcare providers and a tech company called Meta, you may have heard of them recently, have been reported from the improper use of pixel tracking tool on web pages that contain protected health information under HIPAA. And that may just be a patient's name and other identifiers similarly. So we've had major breaches now from online tracking tools. And there seem to be a lot of unintended disclosures here that healthcare organizations may not have been aware that they were actually tracking, or that some organization were tracking across their own web pages. So it's really, really important that your IT team identifies any area where there could be tracking tools. And tracking tools could be cookies, or there are many other types of them. But you need to understand more about this. And I thought this was important enough that I've added a few sentences into our policy templates, and I've added a couple of questions into some of our assessments, because it is an area that was a little obscure in the past, not really asked about directly. So I fixed that for CompliancePro, but you must, for your own self and your organizations, understand the impact here and make sure that you've identified any online tracking technologies and control them, address them in policy and procedure, and address them in training if you need to. The Federal Trade Commission has an article, How to Protect Your Privacy Online. That's a good basic guideline. Talks about cookies, but other things like fingerprinting, targeted ads, web beacons, scripts, or other types of code that gather information about users, analytics data that could be used to figure out online activities. All of those are included and need to be analyzed for. The tech vendor can, or sometimes just embeds, tracking tools on websites' web pages. That's a problem. We need to make sure if any tool is gathering individually identifiable health information, such as patient name, addresses, physicians' names, times, dates, locations, claims, bills, IP addresses, all of that's considered sensitive information. Much of that would be considered PHI under HIPAA. And it's very important to understand that this data can be collected without any visible activity to the user or the owner of the web pages. So while the user's using the web pages, the owner thinks it's all good, there can be tracking going on behind the scenes. And sometimes the organizations implementing the web pages will know that. Other times they may have used vendors or tools that embed that kind of thing. So it's apparently, I know this for a fact, is a very large problem. There are tracking technologies all over the place. Having banners or accepting cookies or general authorizations online, that's not going to protect you. So don't think that because you warn them about cookies, if you're taking patient names and selling them or having someone use the data and mashing it up and doing analytics, things like that, doesn't necessarily protect you by having banners or cookie acceptance on the screen. So be careful. It's not that simple. The OCR has put a web page up for you. Here's the link. Of course, they say this is not law. They're giving guidance, but it doesn't have the full force and effect of law. That's a fine point. Let's just say what they're saying on the web page is in general what you want to try to follow. And we certainly have to think that no regulated entity, meaning a business associate or a covered entity under HIPAA, are permitted to use tracking technologies that would impermissibly disclose PHI, protected health information, to either the tracking vendor or anyone else. So be aware that this is serious, and OCR is now looking for and watching for reports on this subject. And we just have to be careful that we don't have impermissible disclosures occurring because some tool was tracking what somebody did on the website and reporting pieces of that data. Remember that you have websites, you have mobile apps. Those are generally going to be PHI if you're a covered entity or a business associate. Even if the individual doesn't have an existing relationship. So be careful. Let's say I have no existing treatment relationship, but I go to a web page for a provider of care and I fill out a form, or I just have enough information left behind that they could identify me, or similarly, and even that can be a violation. So I don't have to be a patient for my information to be exposed and to be at risk. So we have to be very careful because the web pages and the apps are public facing and many times. And that's where you can get into trouble with this. So tracking technology vendors should be treated as business associates if they're collecting or transmitting information on user authenticated web pages. The user authenticated web pages part, that's for the IT folks. But if it's, let's just say, on your web pages, you know, tracking information on a scheduling web page, those have to be business associate agreements with those vendors that are using those, that are doing those tracking technologies. AHIMA has put out an FAQ. Here's a link to it. I find that it was a informative FAQ, so I would recommend it. And here's some steps from it for covered entities and business associates. I'm not going to read them all to you, but you can see that we've got really a lot to do to figure out the tracking. So, you know, there's no rest for the privacy officer, for the security officers, the HIM folks, the web designers, even in your organization. Be careful about this and make sure that you're adequately projecting where the use of tracking is occurring or may be occurring. Check to see whether it is. Stop it if it's not under a business associate agreement and you understand every aspect of that relationship with that vendor. And of course, put security controls in place to make sure that someone's not embedding online tracking in a way that you didn't anticipate or know about. If you do believe that you've had online tracking occur, you're going to have to treat that as an incident. And it could be a security incident or privacy incident, however you want to call it, but you are likely going to need to evaluate it for HIPAA breach. Is it a low probability compromise or not? Or state breach, if that is also in order to take a look at if you think you've had online tracking occur with any of your patient information already. Consumers, and we're all consumers, right? And increasingly we're consumers with health information, have device-specific things you can follow, like changing privacy settings in your browser, see the cookies in your browser and delete them, control your tracking, look at your opt-outs and opt-ins, change your connected settings. So there's quite a list of things that the Federal Trade Commission put in their article, How to Protect Your Privacy Online, and there's the link for it. We talked about it a couple slides back. But here is pieces from the list, and again, something that everyone should be cognizant of, not only in their professional life, but in their private life as well as a consumer. As far as CompliancePro customers, our customers, as far as online tracking, I did update policy manuals, and that is in the first 2 folders in the reference library. Make sure you analyze your policies about online tracking, whether you're a customer or not, and make sure that you keep the old version of your policies and the new version of your policies for at least 6 years. And that old version of your policies, you probably know that, but let's go over it anyway quickly, which means when you change something in one of your policies, they may ask to see the earlier versions of them, so keep them for 6 years. We at CompliancePro, again, made some changes in our policy templates, but also in our assessment templates. Now, I don't know that it's necessary to go back in your assessments, but as you go forward, if you're using assessment tools from us for security risk analysis or privacy risk analysis, then we've updated our templates to have online tracking and its compliance questions embedded. Information blocking. So as always, in the last 1.5 years, 2 years, we've talked about information blocking. Here's, of course, a link to some materials. I am seeing and hearing, because I do keep my ear to the ground, we do have a lot of customers and they're in various stages of implementation. I talk to them about it, talk to my peers. I'm on the AHIMA Privacy and Security Practice Council, which is one of the most valuable hours I spend of my time because I get to interface with our peers. We've got variations, big variations in how people are implementing information blocking. They're trying to get their arms around the rules, but it is not a consistent thing where I can say everybody's implementing information blocking. They should be, that's the law, but they're not really enforcing it at this point. I suspect it will come with enforcement, but not yet. But that is no reason not to be starting and moving into information blocking, because basically if you have a disclosure that has been requested and you're not going to produce that disclosure for one of 8 different reasons, you have to say why you're not producing it. At least you have to invoke one of the information blocking exceptions. There's 8 of them. So again, information blocking, very important. There are other rules as well that tie in, both from ONC and CMS for the 21st Century Cures Act. Information blocking, however, is a biggie, and many of my audience are struggling to understand, and what are you going to do with your policies and procedures? Exactly how is this going to work? Certainly, many of you will have, and probably some are listening, release of information vendors. You'll want to talk to them too, but there really is going to be up to the covered entity to make the decisions on how you're going to implement your information blocking and get your exceptions in place. So we have gotten a stream of information from ONC on information blocking and the 21st Century Cures Act in general. Here is an article that I pulled in September 2022 about reminders for October 6th of last year. So to remind you, October 6th is when they require the entire designated record set in order to be compliant with the Cures Act. You have to produce it if you have it electronically under the Cures Act. And prior to that, you were allowed to just produce the US CDI, a much more limited data set, but now it's the entire designated record set. It's a little bit perverse, I think, for in pleasure for me. I started in 2009 specializing in privacy because I had to understand the designated record set. And once I got my arms around it, I felt like a lot of other professionals that I worked with really didn't understand it very well because it's complicated and not self-evident what it is. So you can read it but not understand it. It's hard to deal with. So now that the designated record set is taken front and center in the Cures Act, because you have to produce everything in the designated record set that you have electronically under the Cures Act, and then HIPAA requires you to produce everything, but for the Cures Act, worried about the electronic components, the designated record set remains extremely important. I'm not going to go crazy with it here. I've talked about it before. I can give you information. AHIMA has published much good information on this subject, but basically the record set that you designate that you're going to share when you get requested for records under the rules. They could be medical records, claims, billing records, all sorts of things can be included in the designated record set. That's part of the problem. You have to have denoted what is and what is not designated record set. So transcription audio file where a doc dictated discharge summary, not designated record set. The report that gets generated and then they sign, yes, that is designated record set. So you have to understand what's in the designated record set, and that is what now has to be produced should a request come in, unless you have an information blocking exception that you can invoke about that disclosure to prevent that disclosure. The information blocking exceptions are not one size fits all. They are something you have to work with. So that is why I think folks are struggling a little bit on implementation of information blocking, because it's not a cookie cutter set of rules that you work with. Rather, you have flexibility, and you're going to have to figure out for your organization how you use different exceptions. And they're going through in this article and listing 8 regulatory reminders, and I'm not going to go over each and every one individually, but do understand that depending on who you are as what they call an actor is a covered entity, a business associate, or someone else using your EHI, electronic health information, which is basically synonymous with PHI, protected health information, except it's just the electronic component of the record. But depending on who you are as an actor is going to be a little different in how you implement the rules and the information blocking. So if you're a mobile health app developer and you have a mobile health app, how you and what you have to do with disclosures is completely different than if you're a covered entity or business associate. So again, we have to look at your status. What kind of an actor are you? What are you trying to do with the information? And apply the rules as they fit from there. It's just not one size fits all. And I think that, you know, it's still remains to be seen what different organizations are going to do with information blocking. And, you know, again, folks are making progress, but I haven't seen that it's got widespread application yet. Now, again, my friends and customers at the release information vendors probably know much more about this because they're in that line of fire every day. But I am not seeing organizations that we're either doing risk analysis on or talking to about their practices that have completely implemented yet, but they're working on it. So the head of the ONC, Office of National Coordinator Healthcare IT, said a few things that were interesting. So information blocking complaints, because OIG, Office Inspector General, has opened a portal where you can complain if you have an information blocking complaint. ONC manages that. They've had 300 so far. That was, I guess, through February of 2022, probably. But they haven't had a huge number of complaints, considering that OCR gets thousands of complaints for HIPAA. Information blocking is still relatively small. It means the public doesn't understand it yet. Nobody really understands it all yet. They're working on it, right? So we're probably seeing a little more acceleration through October, I guess 240. So, you know, maybe we've had over 1,000 now, but it's still a small, relatively small number compared to HIPAA complaints. The complexity of the enforcement, they say, is delaying generating rules about enforcement. Right now, they're just saying it's appropriate disincentives to having, if you are an information blocker, and they may get you under HIPAA with the patient access program that they have. That's probably other appropriate disincentives part of it. But again, what you should be doing now is creating your data set, identifying your designated record set. In that data set, what is your EHI, what's your electronic health information, what's your designated record set, and catalog. This is what we've been saying for 20 years or so, ever since HIPAA came in. We've created a little checklist for you on the Cures Act, and there's a link for it. Lack of FTC breach rule enforcement. Sorry I'm hopping around so much, but we've got so much content. I do this to myself. Not that I don't like the other areas, but we just have to move on. So lack of FTC breach rule enforcement. And online tracking technologies probably help trigger this. So I did put this one in GoodRx, not to pick on them, but they got a $1.5 million civil penalty for allegedly sharing consumers' data without their permission. This probably came from tracking. And if it wasn't tracking, it was from using data that the patients or the consumers input into the application. So it's a big breach. It's also the first breach the Federal Trade Commission has issued. The last presentation that I did, I was complaining that the FTC had not ever used their breach rule. It's been in place since I think it was 2009. But now it has happened. The FTC made a warning that they were going to start enforcing. Obviously, this was in the works already. And so the FTC was called out by Congress and by others for not enforcing their own breach rules, and they said they would. Well, now they have. So if you want to see more about this breach, you can use the link here. But again, it's intertwining of covered entities, business associates, and now a vendor that is probably neither, and that therefore outside of HIPAA, but the Federal Trade Commission swept them up under their breach rule. So it is absolutely big news. The Federal Trade Commission has created a tool that if you are developing a mobile health app, and you know, most of the folks on this call with us today and that will listen to this presentation are healthcare professionals, fine, but we do get mobile developers that will listen in occasionally, and this is more applicable to you. You may not know what laws apply or think no laws apply to you, but the Federal Trade Commission has this little tool they made. I think it's in Excel, and it's easy enough to use, but if you answer questions in there, they will tell you what rules are going to apply to you. And it's not just about HIPAA and the base Federal Trade Commission consumer rules, but also the FT&C Cosmetics Act, the COPA, the COPPA, Children's Protection Act. So there's different rules that could come into play for these health apps that are going to have patient health information, even if HIPAA doesn't apply. So it's a good tool to know about. 42 CFR Part 2, Notice of Proposed Rulemaking. The Substance Abuse Disorder Rules. So on November 28th, we got a Notice of Proposed Rulemaking. It's really furthering the CARES Act, which is just time and time again, the different pieces of legislation are coming out that are involved with the CARES Act, not the Cures Act, the CARES Act. There seems to be a movement, and I noticed it, and it's been discussed in print, that the substance abuse disorder rules is getting more and more indistinguishable from HIPAA. They're pushing HIPAA together. I think this is 100% speculation on my part that they hurried the Notice of Proposed Rulemaking out in November so they could issue a final rule with the HIPAA final rule. I don't know that for sure. You can absolutely tell me I'm wrong when that doesn't happen, but I think that they'll get them through their 90-day comment period, which is probably what, November, December, it's probably getting close to up. The new final rule probably comes out nearer with HIPAA because they're pushing them together. And that's very important because they are still apart and causing us as record managers grief trying to figure out how to have the substance abuse rule compliance and HIPAA at the same time. But with the NPRM, it's continuing to hammer away on a single prior consent, not specific consents for every disclosure, permitting redisclosure of the Part 2 records, expanding prohibitions, though, at the same time on the use of the Part 2 records in civil, criminal, administrative, or legislative proceedings. There's a stigma at times to Part 2 and or the patients involved with that, and they're upping the protections for use of that information in these civil, criminal, administrative, legislative proceedings. So while they're pushing towards HIPAA, they're trying at the same time to maintain some of the differentiators that are, they're all important, but that are very important. They, under the Part 2 rules, interestingly, created a couple of new patients' rights. The right to accounting of disclosures, you've heard that before because HIPAA has it, and the right to request restrictions on disclosures for treatment, payment, and healthcare operations. That's also something in the HIPAA rules that was never a part of the Part 2 rules. That's now been added, or at least under the proposed rules has been added, and we'll probably see all that in the final rule. They're applying the HIPAA and the high-tech civil and criminal penalties to Part 2. It didn't have that kind of enforcement, and nobody really as much to enforce it. SAMHSA really didn't have that ability. So now there's a process to receive complaints of Part 2 violations. So that it's all being, again, swept closer to HIPAA and under OCR, things like that. You've got to align your HIPAA notice of privacy practices with Part 2, which we always have kind of said you needed to do anyway. But, again, requirements on prohibitions of limiting redisclosure and things like that for legal proceedings, all of that we have to take into account and will probably be present in the new final rule when it comes. Getting close to the end here, security incidents came from the OCR Cybersecurity newsletter. Of course, here at CompliancePro, we manage privacy incidents, but we also have done some security incident management as well. We treat it somewhat holistically in that we believe that, you've got policy and procedures for security and privacy incidents that, one incident may or may not be a security incident or a privacy incident, depending on how you treat it in the, in your own organization. But we've got a fine for a security incident implications, $875,000 in 2022. So because we've had cybersecurity incidents and breaches continue to arise, and we've had so much of it, it just is important to restate that you need a formal process for managing any incidents that arise. Whether they're a hacking IT incident, whether they are any kind of incident, whether it's complaint driven, you find it from monitoring, any of the above, incident management is important and in fact required. You've got to identify any known or suspected incidents. You've got to respond to them. You need to analyze for HIPAA and state breach as appropriate for where you are and how your organization does that. You've got to mitigate for the incidents. You've got to document, and you've got to keep the documentation for 6 years. This applies to all incidents, security incidents in particular, but it does any HIPAA-based incident, or these are the same steps you're going to use. What else should you be doing? You need to have a security incident response team. So when a security incident happens, maybe a cyber incident, whatever, you need to have the team that can get into place immediately. They check for this. This is required. You identify the incidents according to different ways, right? There's monitoring, there's complaints, but as many ways as you can think of and afford, you need to try to identify security incidents, use automation as much as you can, respond, mitigate, document, and again, understand your breach reporting because that's important. The Sequoia project, I just listing them because I don't know if you all are members, but I am, and several of my peers are. And I have just found that when we're talking information blocking resources, this is an outstanding source. And they have what they call good practices in the industry. We typically say, well, the best practice is this. Good practices are a variation of best practice. But take a look at the Sequoia Group if you are, or the Sequoia Project, if you are working on information blocking, because I believe they have a lot of resources and we use their resources here. In conclusion, keep your eyes on the privacy, security, cybersecurity balls that are in the air. Take the knowledge that you have into your organization and be a leader in that area. It's going to impact your daily operations. Let's watch for the HIPAA and the 42 CFR Part 2 rules this spring. Assess, document, mitigate any risks that you find with online tracking technologies. Understand about the recognized cybersecurity practices, especially the 405D rules. Keep pushing on the Cures Act. Keep implementing your information blocking processes. Use subject matter areas if you need help. That's what a lot of us are here for, is to help you. It's very difficult and intertwined. We see a lot of different types of intertwining. If there's developers that are developing data exchange or health information exchange, there's HIM practitioners trying to figure out how to implement information blocking. There's others trying to figure out how to educate patients on the Cures Act. So there's a lot of intertwining here between HIPAA and the Cures Act, other rule sets, and you may need subject matter expertise sometimes. That's fine. Just ask for help if you do. Thank you very much for your time, and I am going to see if I see any questions, but I do not. So I will curtail this and say thank you for listening in, and we appreciate you very much, and we will follow up with the email. Thank you.